Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. I'm Dr. Jared Skowron, 20-year biomedical autism doctor, and today's podcast we're going to be talking about a behavior that a lot of our kids with autism have, which is OCD. So, OCD, as many of you know, is obsessive-compulsive disorder. It's a behavior that a lot of us have, whether a little bit or a lot, where we want to make sure things are in a certain way. And of course, it's fine having things in a certain way. What becomes a problem is when those impulses, when those obsessions that we have to have things in a certain way tend to overwhelm us, they affect our life and they affect our quality of life. So what we need to do for our kids is understand why they're having the behaviors that they have and how we can help them feel better. Because these OCD behaviors that our kids have is really our kids feeling anxious and feeling nervous and feeling scared and trying to control their world. So if we can make them feel happier, if we can make them feel calmer, hopefully those behaviors will be easier for them to not have to do. So let's dive in. And again, what we do here at Autism Awakening, we're here to help you help your child with autism, and we focus and specialize in natural therapies to help your kids. Now, many of you who have kids with autism, of course, are using standard therapies like speech therapy and occupational therapy and ABA, and you may be trying to use ABA to help your kids with these OCD behaviors. But what we really try to get to the core of is understanding that autism is a medical condition, and if we're able to help medically, if we're able to help biologically, not with pharmaceuticals, but with natural therapies, we can help our kids the best with the fewest side effects. And that's our goal, is to help our kids feel better. So let's get into it. And what I wanted to do is I found I found a really great general article about OCD. And then we're going to get into some science about different natural therapies that help with autism and OCD, or just natural therapies that help with OCD. But I really want you guys to kind of get down into understanding why this is happening. Because when I'm working with patients and I'm working in my telemedicine clinic, I really try to get to the core of why we do things, all right? And a lot of why we do things it's these choices that we make to make ourselves feel good. And that's really human nature. Human nature is, hey, I want to feel good. I want to feel happy. I don't want to feel scared. I don't want to feel nervous. I don't want to feel worried. So I'm going to try to do things that make me feel better and make me feel safe. And I think when we get to OCD, we're really hitting kind of that old caveman kind of instinct where I need to be safe before anything else happens. Now, from a biological perspective, this is called the sympathetic nervous system, which is our fight or flight nervous system. It's what keeps us alive. And opposite to that, on the other end of the continuum, is the parasympathetic nervous system. Now, the parasympathetic nervous system is the nervous system that makes us calm, it makes us relax, it makes us go to the bathroom, it makes us read a book. So we've got these two sides of our nervous system. We want to make sure that that's in balance, so we have a little bit of everything, which is what we need. All right. Excuse me again. Let's start into, I want to kind of read this overarching article about OCD and understanding why it happens. So we're going to get into this biology of why it happens and the biology of our feelings and the biologies of our emotions. All right. So let me hold this up to the screen. It's kind of tiny print, so I'll put on my cheaters. This is the pathophysiology of obsessive-compulsive disorder. All right, so what does it say? And I really liked what it said here, so I want to make sure I read it. OCD is recurrent and uncontrollable thoughts called obsessions, and they produce anxiety. And those are followed by repetitive behaviors, which we call compulsions, that reduce the anxiety. We have these irresistible urges to perform repetitive rituals. Now, those might be recurrent thoughts, those might be images, those might be impulses, but these repetitive rituals serve to counteract the anxiety that precipitated by the obsessions. All right? So I really love how they wrote that because, forever I hear psychiatrists talk about OCD. They're like, oh yeah, you have OCD and you just want to do these things. But never really get to the core of why I want to do these things. And we've always got to go deeper down that rabbit hole Why am I doing these things? Why are my emotions there? Who's feeling those feelings? Take a step back outside the feelings. Say, okay, you're feeling this feeling. That's not me. Who's feeling that feeling and why? All right. It's about anxiety, and anxiety is about safety. So OCD is having these obsessions, having these rituals, having these repetitive behaviors because they make me feel good. They make me feel safe because they reduce that anxiety. Okay? And really, I really liked how they kind of laid it out here. So they were getting into the medical biology of it all, and I think it kind of covers two different areas, and they kind of described them well. So let's get into the first area. Now, the first area has to do with brain chemistry, and of course, our emotions have a lot to do with the chemicals in our brain. Not everything, but a lot. So we think of things like serotonin, we think of things like dopamine, we think of things like adrenaline and GABA. These are all participating in how we feel and how we think. So what this research study has, I can read what I highlighted here. I can read what I highlighted here. Dysregulation of the serotonergic systems has been suggested as part of OCD. So imbalanced serotonin. Abnormalities of the dopaminergic system have also been implicated in the pathophysiology of OCD. That's dopamine. More recently, an increasing body of evidence points to the involvement of the glutamatergic system of OCD. This is glutamate and GABA, glutamate and GABA. There is also some evidence suggesting the involvement of nitric oxide, NO, in OCD. So let me summarize this. Dysregulation of serotonin, dysregulation of dopamine, dysregulation of glutamate and GABA, dysregulation of nitric oxide are all part of what happens when we have OCD, okay? So that's really encouraging stuff. Those changes in those brain chemistries, they are going to change how we feel. All right? When we start to change our brain chemistry, whether we're using natural supplements, whether we're using pharmaceuticals, we feel the emotional difference. So we know that these are associated with anxiety. We know these are associated with the obsessions that we're trying to self-soothe our anxiety. But it becomes chicken and egg. So when I say chicken and egg, if we start to intervene and treat those brain chemicals, we see results. We see improvements. We say, hey, I'm feeling better here, and that's great, okay? But if you stop those, then those OCD tendencies can come back. Those anxieties come back, those obsessions can come back, those compulsions can come back when you stop the treatment. So I really don't think that's the core of what's going on. I think that's just part of the whole biology. So let's continue into this research study. Where does that come from? And I think you guys are going to love this because this is right up your alley. Many children with obsessive-compulsive disorders have high-frequency symptoms of checking things, fear of harming others, obsessions relating to death, or sex-produced compulsions serving to avoid a horrible event. And what do we have here? Strep infections. Okay, strep infection. It was noted the OCD symptoms, along with choreic movements in the Sydenham chorea, became worse. This was mediated by anti-neural antibodies that adversely affected basal ganglia cells. It was later hypothesized that the abnormal reaction to the strep bacteria, that's GABHS, might play a part in the etiology of OCD. The subgroup of OCD patients has been termed PANDAS, the pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. Children with PANDAS have enlarged basal ganglia. So this got a little bit medical, but let me basically flatten it out for you, okay? PANDAS can cause OCD, all right? For those of you who aren't aware of PANDAS and have just kind of heard the term, PANDAS is an autoimmune condition that attacks the brain. Now, why does that happen? It happens because it's triggered by an infection, okay? So the term PANDAS is the term for the autoimmune condition against the brain after you have strep infection, like strep throat, all right? There's another medical condition very similar called PANS, and PANS is the same thing. It's autoimmune condition against the brain, but it's from a virus versus from a bacteria. Now, in my opinion, it can be from a multitude of different organisms. Doesn't have to be strep, doesn't have to be a virus. It can be a parasite, it can be Lyme, it can be mold, it can be a worm, it can be a million different things. But what happens is the immune system gets confused and starts attacking part of the body because it thinks it's that organism. All right? And that autoimmune attack creates inflammation in the brain. That inflammation in the brain is going to create those changes to our brain chemistry. And then we start getting the symptoms. So I want to kind of paint this picture of domino effect for you guys, is that where do these, why does my kid like to look at the cars or line things up or, have to do certain things on the wall or on the doors before we leave the house? Why do we have those compulsions? Well, it makes us feel better, all right? Why aren't we feeling good? We're not feeling good because these abnormalities in brain chemistry are creating those feelings, okay? Why are those abnormalities there? In my opinion, many of our kids with autism is going to be because of this autoimmune reaction, this inflammation in the brain, pandas, pans, whatever name you want to call it. There's inflammation in the brain creating those abnormalities. Another thing that can cause those abnormalities in brain chemistry is just different genetics that we're born with, okay? Some people are just genetically happy or genetically sad or genetically worried or genetically have OCD. Oh, my mom had it and her mom had it and yada, yada, yada. It's obvious in our family, all right? And those just have to do with the genetics of brain chemistry and how we're probably going to feel, that predisposition to be very similar to our parents, because that apple doesn't fall far from the tree, okay? So I hope that painted a nice picture for you. Another note that I wanted to make from what I just read, which is interesting, is that they highlighted a medical condition called Sydenham chorea, all right? Sydenham chorea, in my opinion, is pandas. It's PANS. It's the same thing with an older name. Pandas is a very new name. Sydenham chorea is what they used to call it back in the 20th century. Back in even earlier than that, they used to call it St. Vitus dance. And I know a lot of doctors don't believe pandas exists, okay? But guess what? Sydenham's chorea has existed for 100+ years. We know what it is. It has to do with the OCD, and it has to do with a lot of physical motor tics. Now, those motor tics can be the stimming that we see, they can be other non-stimming motor tics, or they can be as severe as seizures. So this is a great overall description of OCD and what's the biology behind it. It's the imbalance in brain chemistry, which again, either genetics or inflammation. That inflammation can come from this autoimmune attack of pandas or pants. All right? Now, what do we do about it? That's what we got to get into, okay? So I would say the first thing to talk about, or again, we've kind of looked at these two different biological causes of OCD. Number one, let's talk about the brain chemistry, all right? The abnormalities of brain chemistry are that immediate medical cause of the symptoms, but they're not what originated it to begin with. So we can balance and we can change brain chemistry really easily naturally. So we're going to be talking about different natural things to balance brain chemistry. Then we're going to go to that other side, which is the inflammation and the infection. Okay, so if this is caused by an autoimmune attack, we've got inflammation and we've got an infection that's there creating that inflammation. Okay, let's get to the brain chemistry first. I want to first kind of highlight the protocol that we've created to balance brain chemistry. And this is what we call the Skowron solution. Skowron solution is just 4 different supplements, and many of you have tried it. If you haven't tried it, I'm going to run through it with you. These are 4 supplements that balance brain chemistry, okay? And I decided to make 4 different supplements and just kind of put it all in one because we're all a little different. We're all a little different genetically, and you want to make sure you can adapt any kind of treatment to be best for your kid. So the first thing we want to do is reduce the accelerators. We want to reduce those stimulants that are creating that anxiety. Okay, and as we went back to that research study, it was the glutamate. Too much glutamate is causing a lot of that anxiety. So the first thing we do is, here's a supplement I formulated called Anger Management. Anger Management is going to reduce glutamate, period. It's also going to reduce adrenaline, which is great, all right? So it's calming that down. The next thing we want to do is kind of, again, make you feel a little bit happier, so we want to increase serotonin. So increasing serotonin is easy. These are little 5-HTP tablets that you can chew up before bed. These are going to increase your serotonin levels, all right? I'm going to be showing you some scientific research soon. Don't worry about that. We always back our natural treatments with science and scientific research. All right. After that, we want to make sure we increase folinic acid and B12 levels with the best forms that are out there. And we've got our super folinic acid. This is a combination of folinic acid, B12, vitamin D, ATP. Did we put ATP in here? I thought we did. And choline. All right, APC. Last but not least, and again, going back to that study, what did it first say? Serotonin's abnormal. Dopamine's abnormal. Glutamate's abnormal. All right? And then we've got attention on the double. Attention on the double is our supplement that's going to increase dopamine levels. Again, going back to that study, dopamine abnormalities are there creating these symptoms, okay? Jasmine says super serotonin is the most amazing supplement. Thank you, Jasmine. I know it's working for Charlie, which we love. All right, so you can use natural supplements to change brain chemistry. Why? Because everything in our body is made of the foods we eat, okay? Every single molecule, every single chemical, every single hormone is made of the food we eat, the water we drink, and the air we breathe, period, okay? So that's number one. A couple other things you can add on, tried to pull it out here. The other thing that the research study talked about was GABA. GABA levels are very low with OCD, so we have a chewable GABA. You can go get other GABA out on the market as well, but that's great stuff too. All right, so use those things to help your child with OCD. Use that to increase their anxiety so they feel happier. When they're happier, they won't have to have all these compulsions to make things a certain way to make them feel better, all right? I always tell my patients, if your child has a behavior that's not hurting themselves or hurting others, whether they're stimming, whether they're flapping, whatever they're doing, if they're doing it and they feel good, let them do it, okay? It may look weird, it may be socially unacceptable, but if nobody's getting hurt, let it happen because they're doing it because it makes them feel better, period, all right? So try those different supplements and adapt them. Okay, if one helps and you want to try a little more, if one really doesn't do well for them, let's go a little less on that one. Adapt it to your child because we all have different genetics. We all have different genetics that set up our brain chemistry. Okay. Next, where do we go from here? From here, we go to the autoimmune attack. We go to inflammation and we go to the infection. Now, quick comment. Deb said supplementing GABA increases glutamate in some people. It's true. That's why we got to trial and error this stuff, all right? But don't throw the baby out with the bathwater. Because a supplement's bad for one kid, it might be good for you. If a supplement's good for one kid, it might be bad for yours, okay? Trial and error is what's important. And that's why Spectrum Awakening has a 30-day return policy. They'd rather you try something and send it back for a refund than not try it at all because there's too many things that can help your child, okay? Next, inflammation, infection, autoimmune, pandas and pans. How do we treat it? It's tough. It's really tough, okay? But it's a combination of anti-inflammatories and killing an infection that's still there. These chronic infections, this other long viruses that have, are out there and have been for a few years. I don't say the name of it because it triggers us on YouTube. So, we can have infections for a long time. I mean, think about those of you who are dealing with gut infections or candida or mold with your kids. That stuff can last years. Parasites can last years. If you don't know it's there and you don't treat it, it could stay there for a long time. Same thing with Lyme and other tick-borne illnesses. Can stay there for years, if not decades. Think about the viruses that stay with us for life, okay? I mean, I'll date myself here as a Gen Xer, but Eddie Murphy says herpes like luggage, it stays with you forever. So we do get these viruses that last a long time, okay? Period. Same thing with chickenpox. All right, you had chickenpox. I had chickenpox. Guess what? That chickenpox virus is still in our body, and one day it may come out as a different medical condition called shingles. Some viruses stay with us forever. Got it? Okay, so what we do is we want to kill those off and use anti-inflammatories. The anti-inflammatories that we use or that we have on our Spectrum Awakening website, number one is curcumin. All right, so this is our curcumase supplement. Curcumin is a great anti-inflammatory. This is another one which is a little harder to find, but it works really well. This is called Panda Bear. Now, Panda Bear is a tasteless powder of a supplement called palmitol ethanolamide. That's PEA. So PEA is an amazing natural supplement that really reduces inflammation really well. It actually acts on the cannabinoid receptors. So if your child does do well with CBD, they may also do well with PEA. So give it a try. And this is totally tasteless. This is the tasteless powder we've made, which is cool. And you also want to balance the immune system by understanding hormones, okay? And the hormone that most affects our immune system is cortisol. So we want to make sure we've got nice, good, healthy levels of cortisol, because when we don't, that's going to increase inflammation. When cortisol levels are low, inflammation is high, and vice versa. When cortisol is high, inflammation is low. That's why I like to use our herbals, such as Temper Tamer 2 and Temper Tamer. There they are, Temper Tamer, Temper Tamer 2. These are different herbals that will change your cortisol levels. They work really well. I take Temper Tamer every morning. It really helps with giving that emotional endurance so you can handle life and not break down. It's great stuff. Okay, so we've talked about brain chemistry. We've talked about anti-inflammatories. We've talked about modulating cortisol to help with the inflammation as well. All right, but where's the science behind it all? Let's get into the science. Okay. Here we have boosting serotonin. So, with boosting serotonin, 5-hydroxytryptophan, or 5-HTP, is an adjuvant therapy in the treatment of moderate to severe OCD. What we have down here, 5-hydroxytryptophan may be effective as an augmentation agent in treatment to moderate to severe OCD. It's great stuff because 5-hydroxytryptophan, it's also known as 5-HTP, that's our super serotonin support supplement, okay, as a chewable tablet. That's what the body uses to make serotonin. You take this stuff, serotonin levels go up, period. What is serotonin? It's happy, it's calm, it's relaxed, all right? We got to make sure we've got good serotonin. Serotonin also helps with pooping, all right? So if you do have a kid with chronic constipation, 5-HTP can help with that a little bit as well. It's not going to blow you out, and if you have diarrhea, don't worry, it's not going to make you have more, but it just keeps that bowel moving. Okay, here's another research study, kind of echoing what I showed you first. Glutamate and GABA are related to compulsive behaviors in individuals with OCD. That elevated glutamate and lower GABA levels are what are seen in the brains of OCD. So we want to lower that glutamate level. That's why we have the anger management supplement. That's what that does. We want to increase that GABA. Take a GABA supplement. See how you do, okay? We also have this research study that says there's decreased GABA in individuals with OCD. There we go. Decreased plasma levels of GABA. Really simple. They drew blood in those with OCD and drew blood in those that don't have OCD. GABA levels are lower in those with OCD. What is GABA? GABA is a protein, okay? And it's a protein that pushes on the anti-anxiety button in the brain, okay? Right on the amygdala. It says, hey, relax, calm down. GABA is great for helping you feel less anxious. All right, we talked about cortisol. We talked about that stress hormone. You want, and again, the lower the cortisol, the higher the inflammation. The higher the cortisol, the less the inflammation. And the higher the cortisol, the more stress you can handle. It's called the stress hormone, but most people interpret that as, ooh, it causes stress. No. It helps you handle stress. All right. Low hair cortisol concentrations in OCD. Period. Okay? Chronic low cortisol secretion in OCD patients could be attributed to or as an adaptive response to chronic stress exposure. Okay? Cortisol levels are lower. Period. And that's going to create more inflammation, and that's going to kind of roll in with the pandas and such. Susan says, wow, that explains a lot. That's why we have these podcasts, Susan. We want to make sure you understand what's going on with your child or maybe even yourself. All right. Now, we talked about OCD. All right, OCD can be autoimmune and neuroinflammation. That's brain inflammation. OCD is associated with low-grade inflammation, neural antibodies, neuroinflammation, and autoimmune disorders. OCD patients, autoimmunity is likely triggered by specific bacteria, virus, or parasites. I'm telling you, people. So many people have parasites and don't even know it. Don't even know it. Deb says, how does sugar increase OCD? Because it feeds the infections in the gut that will then stimulate that behavior. All right, anti-inflammatories. Remember, that's definitely part of it. Curcumin for neuropsychiatric disorders. Curcumin is an anti-inflammatory, antioxidant, neuroprotective, and monominergic, which means it helps with dopamine. Potential of curcumin as a treatment for neuropsychiatric disorders such as depression, PTSD, and OCD, bipolar, psychotic disorders, and autism are reviewed as beneficial in this research study. Hey, let's go back to that brain chemistry stuff, huh? B12 levels, folate, and homocysteine in patients with OCD. What they found is vitamin B12 levels were low or decreased in people with OCD, and homocysteine levels were increased in OCD patients. Homocysteine is an inflammatory chemical in the blood vessels. So what it does is it causes inflammation in the blood vessels of the brain, opens up your blood-brain barrier. That causes more inflammation and more problems. B12 and folate will lower that homocysteine, and what this research study said was that the B12 levels were lower in the OCD. That's why the folinic acid supplement is so important, okay? Diane says, when my son stops taking digestive enzymes, he develops OCD. Sure. What does a digestive enzyme do? It digests your food. If you're not digesting your food, what happens? Well, the food sits there and ferments and causes inflammation. Period. Okay. Cleo says, please come to South Africa. I would love to come to South Africa, Cleo. You know what? If there's an organization that we can work with to kind of set up a conference, a webinar, something, let's make it happen. Let's get a big group. If we can get 100, 200 parents, let's do this. Love to fly down. I love to travel. All right. Somebody briefly mentioned, I didn't get into it, NAC, N-acetylcysteine, and vitamin D supplementation in treatment-resistant OCD patients, okay? The possible benefit mechanisms of NAC for this disorder will be discussed in the study, as well as the role of vitamin D supplementation. But NAC and vitamin D together can help with OCD. Why? Vitamin D, anti-inflammatory, period. Okay? More vitamin D, less inflammation. Awesome. The NAC increases glutathione levels. All right? Glutathione is a substance that repairs damage. All right? So when you have inflammation, things are damaged. So the glutathione is going to help repair that. When that's repaired, that helps stop that inflammatory cascade. All right. Last study, just straight up vitamin D deficiency. Vitamin D deficiency in OCD disorder patients with pandas. All right. Moreover, OCD patients with vitamin D deficiency had a higher rate of comorbid ADHD than those without a vitamin D deficiency. Man, get on your vitamin D. It's so important. And even if it's summertime, even if you live in places where there is a lot of sun, you can still be vitamin D deficient. All right? Especially if you're inside. I don't care if you live in Florida. If you're inside all day, you're not getting the sun. You're not getting vitamin D. When you put sunscreen on, that prevents the ultraviolet rays from hitting your skin and prevents the vitamin D production in your body. So many of us need vitamin D. Trust me. All right. Whew, that was a lot to go over. I liked it. Let me give the coupon for the weekend, then we'll start to give the live questions. All right. This weekend's coupon is OCD20. OCD20 is going to get you 20% off any of our supplements, any of our lab tests on SpectrumAwakening.com, even the bundles. That expires June 9th, 2024. If you want one-on-one help, schedule a video appointment with me. Schedule a telemedicine appointment. I have a telemedicine clinic. I talk to patients around the world, and I love helping kids, whether they're down the street or on the other side of the continent. Doesn't matter. We're here to help you guys. All right. Let's do a quick review, and then we'll answer some live questions. OCD, all right? They are obsessions, they are compulsions that we do that can affect our day-to-day quality of life. When they affect our quality of life, then it becomes a problem rather than just, hey, it's something that I do, okay? Why do we do these things? We do these things because they make us feel safe, they make us feel happy, and why aren't we happy? Okay, are we not happy because of imbalances in brain chemistry like low serotonin levels or high glutamate or low GABA or low dopamine? These changes control our behavior to a certain point. Okay, why are those abnormal? Now, it could be genetic, just could be, hey, you know what, my dad's like this, my mom's like this, yada yada. But it can also come from inflammation, especially in our kids with autism, where they have a lot of brain inflammation, whether it's pandas, whether it's PANS, whether it's some other cause of brain inflammation. Treating that also can help with the OCD. Now, how do we treat that? We can give anti-inflammatories like curcumin and PEA, like our curcumin and Panda Bear supplement. Also try the Skowron solution to balance those brain chemistries, see what works for you guys. And what was the other thing I was going to mention? NAC, vitamin D, and really important is making sure those cortisol levels are where they should be. Cortisol, your stress hormone. Lower cortisol, higher inflammation. Higher cortisol, lower inflammation, okay? That's why they use prednisone for autoimmune conditions. Prednisone is a massively strong adrenal hormone. All right. And that'll shut down autoimmune disease. Now, that's way too strong for many of our kids, except in certain medical situations. So I wouldn't take it on a regular basis. But the more adrenal hormones we can support within normal range, the less inflammation there will be. Great. All right, guys, let's get to the questions of the day. And again, if you're listening to this podcast not live, if you're listening on Spotify or Apple Podcasts or Google Podcasts or maybe our YouTube or our Rumble channel, we record this live on our Facebook page, Spectrum Awakening, every Thursday at 12:15 p.m. Eastern Standard Time. So you can come, you can take part in it, you can ask live questions, and we have a good time. Guadalupe says, good morning, Doc. Quick question. Can I give my child attention on the double power and focus of folinic acid all in the morning? Yes, you can. Mix them all together. Jasmine said, Charlie's doctor prescribed NAC for a sinus infection, and since taking it, we've noticed symptoms improving. Is it okay to take NAC long term? Yes, it is, Jasmine. NAC is a protein. It's just a protein. You eat protein every day, or you should. So keep taking it. Alexandra, our favorite Romanian, wants to do a podcast. Yeah, why not? Let's do it, Alexandra. Sounds great. Jen, hey, super excited. I have an appointment coming up with you at the end of this month. My 4-year-old has started headbanging for the past 5 weeks. I wondered if there was anything I should start giving him. Well, headbanging is pain, okay? I'm trying to stop the pain. Now, is the pain a headache? Is it teething, okay? Is it an ear infection? Look for the pain first, okay? He's almost made a stim out of it. He seems to do it both when upset and happy. Look for the pain. Maybe try a little bit of ibuprofen because, if ibuprofen works for behaviors, it's inflammation. All right. Now, we can't use ibuprofen long term. You're going to get an ulcer. And we don't use Tylenol. Make sure you guys are on the no Tylenol bandwagon. I've just posted on our Instagram channel. If you don't follow us on Instagram, go to Instagram Spectrum Awakening. Make sure you follow us. I'm posting a bunch of reels about acetaminophen and Tylenol, and they're all around scientific research, and they're all revolved around a great interview I had with one of the leading Tylenol researchers in the world, Dr. William Parker. I interviewed him a few years ago. Genius, and all his work is about acetaminophen, Tylenol, paracetamol toxicity, and how it's involved with autism. So check out those reels on Instagram. Janice, and we also have the video on our YouTube and our Rumble channel. Janice, what if you have an adult child who has dealt with OCD since childhood but is not autistic? Same thing. Doesn't matter, okay? There's no difference between OCD and autism and just OCD. It's the imbalance in brain chemistry that causes the symptoms and potentially the inflammation. Are there tests to see this biology? Yeah, we can run tests on brain chemistry. We can run tests on inflammation. We can run tests for infections. We can check all of that. Okay. If you guys are interested, ask your doctor or set up a telemedicine appointment with me. We order lab tests everywhere in the world. Alicia, good afternoon. Have you heard of pathological demand avoidance? Yes, I have. I've been accused of it as my wife. Are you going to clean the bathroom? No. Smati, hey doc, can we do detox when a child is on seizure medication? I would double check with your pharmacist if there are any contraindications with the specific detox protocol you're using. Diane, my son has high dopamine. Can I skip the tyrosine? Of course you can. You've got to make this stuff adaptable to your child. Janice, what supplements can help them if they're currently on Prozac? Use the Skowron solution, but don't take the super serotonin. And I say that just being safe, because you're not supposed to take 5-HTP with Prozac and other SSRIs. But the research study that I showed first, this 5-HTP as an adjuvant therapy to moderate and severe obsessive disorders, they actually used 200 milligrams of 5-HTP with patients who were taking 60 milligrams of fluoxetine, an SSRI. So they're on 60 milligrams of fluoxetine, and then they gave them an extra 200 milligrams of 5-HTP. We're supposed to avoid it because they could counteract, but interesting study. Jasmine, super serotonin is the most amazing supplement. Thank you. I'm glad it works. Tochi, when's the best time to give my kid Temper Tamer 2? The morning. Started one capsule 3 days ago, and he noticed he gets irritable a few minutes after taking it. All right. Then try it at night. And if that doesn't work, switch to the Temper Tamer, not the Temper Tamer 2. Tochi, forgot to add that he was so irritable on Temper Tamer, that's why we decided to try the Temper Tamer 2. All right, got it. Then try the Temper Tamer 2 in the evening and see if that helps. All right, Rena. Hello, Doc. Hello, Rena. Deb, aggressive OCD rituals, compulsions to injure self where the pain is, or breaking things, rituals out of their control, how to treat. If there is pain, treat the pain. Okay? Where is the pain? Why is the pain? That's what you've got to figure out. Okay? And then, is that anti-inflammatories? Is that antimicrobials? Is there another reason for the pain? Stop the pain. Cleo, the spectrum is so wide, how do we know what is actually working and what is not? That's a great question, Cleo. One thing at a time. It's the only way we can find out. Do one thing at a time, give it a week or two, try something else, give it a week or two, and go from there. Okay? Cleo, what happens is we try something and then something else is told to be added. How do we know which one is actually working? You just got to give stuff time. It's hard to say. You know, there's some people who say, I just want something to work, throw the kitchen sink. And other people are like, look, I just want to use what is necessary. That's trial and error. Okay? You can do elimination trials too, Cleo. I mean, I tell a lot of my patients, hey, you're taking 20 things. It's a lot of stuff. Why don't we just take one out at a time, give it a week, you know? Are they the same? Don't need it, okay? Or wait, I take it away. Ooh, things got worse. Put it back in, okay? Do an elimination trial, add them one at a time, take them away at a time. That's it. Kim says, we're using temper tamer for over a month. How long should our kiddo stay on it? It seems helping with his outbursts and meltdowns. I'd stay on it then, Kim. Stay on it. Months, you know, year. Again, we just want to normalize our cortisol levels. Alyssa, doctor, we scheduled an appointment with genetic doctor. What questions should I have ready for him? Well, number one, it depends. If you need the testing ordered, order the tests. Okay? Hey, I need those tests. I need them all. Okay? If you have a result, then you basically say, hey, I got this genetic result. I need parent testing if you don't have parent testing yet. And then what's the treatments? Where are the research studies around the world for this gene? What can I do? What does this gene do? And if this gene isn't working, what is not functioning in the body? How can I replace that function? That's what we do. Deb said, hydrocortisone, low dose helps here. Exactly. Adrenal support helps with inflammation. Okay? Adrenal fatigue increases inflammation? Yes. And OCD? Yes. Carla, is there such a thing as too much vitamin D? There is. It takes a lot, though. I mean, I believe... I went to the NIH years ago for a vitamin D conference, and I believe the toxicity levels for vitamin D is taking 40,000 IUs a day for 6 months. It takes a lot to get toxic with vitamin D. If you're concerned, get a blood test, check your vitamin D, and check calcium. Because the number one symptom of too much vitamin D is high calcium. That can cause kidney stones. All right. Deborah, what causes kids to go nuts on NAC or glutathione? Good question, Deb. I'm suspicious about a couple things. Number one, I'm suspicious with kids who have polymorphisms in sulfur genes. I also am concerned that it's a die-off reaction. So what I want you to try is push some binders with your kids and see if that helps when you're doing the NAC or the glutathione. Sharon said, for leaky gut, can I use Gut Calm or Gut Immune Axis? Yes, you can use either. I think Gut Calm's a lot better. It's pricey. It's an expensive supplement. It costs a lot to make with the ingredients. There's a lot of great stuff in it. But either one you can try. Gut Immune Axis does have shellfish ingredients from shellfish. So if you have a shellfish allergy, you got to watch out for that. Janice, when starting the supraflinic acid and the intention on the double, is it common to have 2 days where you see some behaviors pop up? Yep. And give it a couple days and things settle back down again. They could. If they don't, drop those doses in half. Diane, I have to rewatch this. Please do, Diane. Keisha, do any of your supplements contain phosphatidylcholine? Hold on a minute. Yes. That wasn't what you were looking for, Keisha. That wasn't what you were looking for. Yes. Our folinic acid and our power and focus have alpha phosphatidylcholine, APC, okay, which is a great form. Linda, saw you in San Antonio. I'm glad you caught alive too. Hope you guys are doing well. David, what do you recommend for ADHD? We have a private teacher working with our son. Can't sit down for more than 15 minutes. It's brain chemistry and stress. Try the Skowron solution. Balance the glutamate, balance the serotonin, balance those dopamine levels. See what works, and then go with that. Kim, can my kiddo take serotonin with 5-HTP regularly? Yep. Laura, my daughter is currently using Common Cool anger management and attention on the double. When she has her period, she self-injures, become more aggressive. We're managing her pain, but is there anything you could add at this time of the month, please? Yes, I can, Laura. Do I have it in front of me? Oh, here we go. Try this. SD Balance. Okay, this helps balance estrogen progesterone levels. It's an herbal supplement, and that can help a lot. So I would try that. I would take one a day. What do the instructions say? Say one. This says 1 to 2 a day. Start with one a day. Give it a month, and then see what happens. You may also want to try some magnesium if it's just bad cramps, bad uterine cramps. Magnesium can really help that. We also have a magnesium cream called Calming Cream, and you can rub that right over the pubic bone, right over the uterus. It kind of soaks in and relaxes the uterine muscle lining. Cleo, I'm using a zeolite powder for my 11-year-old boy, and waiting to see on results. He's stuck on echolalia, no expressive conversations, was recommended by a mom who gave your 11-year-old daughter. We parents need your guidance desperately, Cleo. Hey, get a group and let's get me down to South Africa. I'll be there. Zeolite is a good detox. We're actually in formulation of a new detox supplement with zeolite. So it does help some, but it doesn't help all. Okay. What you've got to do again is it's all about order, Cleo. It's all about order of how we're helping these kids. I want you to go to our website, spectrumawakening.com, and we have free ebooks you can download. All right. I want you to download the beginner's guide and the advanced guide. Read through that because it's an order of operation. Okay. It's an SOP manual on how I help our kids and have been for 20 years. And detox is great, but it's one of the last things that you want to do because there's so much else going on that you need to address first. Okay. Diane, why does detoxing take so long? I can see brain function improvement, but I need these heavy metals to get out of the body fast. There's different ways to detox. There's different treatments, and the slower stuff is safer. And you can do IV chelation. That's really fast, and that's great, but there's more side effects. So it's a seesaw. It's a seesaw of risk-benefit. Sushma, I have genetic testing results from MaxGen Labs. Wondering if you would be able to interpret them during your appointment. Of course I would, yes. And I want you guys to understand, and please make sure, go back to my first podcast of the year in January. And those of you who are new to Spectrum Awakening and our podcast and our Facebook Lives, the first 3 months of 2024, I kind of did a biological, biomedical overview of autism, okay, in the order that I want you to think about things. The first one was about genetics, okay? There's a difference between genetic testing, which will diagnose genetic conditions you were born with that cause autism, and genomics. Genomics is just the different genetic tendencies we have. We're happy, we're sad, we're morning people, we're night people. I can smell asparagus in my pee, I can't. Genomics is not medically diagnosing, okay? But it's good, it's important. I could be happy to interpret that for you. But that's not all the genetic testing out there, that's my point. Janice, thank you so much for offering Q&A time. You're welcome, Janice. We've been doing this for 5 years. Deborah is talking about a certain binder. I'm not sure what that binder is. There's a lot of binders out there. And Deborah, we do have a distributor in South Africa. I think the website's name is like Synergy or something. Just Google Spectrum Awakening South Africa. We have a guy who distributes some of our supplements, not all. But go from there. Sorry, that wasn't Deb. That was Cleo. Janice, looking forward to our first appointment on the 20th. I can't wait, Janice. I'm here to help. Marco, can you comment on what to look for in a good probiotic? What particular strains are most helpful for autism? Well, again, there is no one size fits all. So, when you get probiotics, you're going to get lactobacillus, you're going to get bifidus. There are certain strep strains of probiotics. Some kids do well on them, some kids don't. Then there's Sac Boulardii, and Sac Boulardii is more of a probiotic yeast. There's different research studies on different probiotics. This one helps, this one helps, this one helps. Frankly, I think a lot of that research is just marketing by a company who's like, look at mine, look at mine, look at mine. So I think what's better is kind of broad spectrum shotgun approach. All right. So we've got check out a probiotic on our website. It's called Gut Reset. It's a good hefty dose. It's 30 billion. It's multiple strains of lactobacillus and bifido. I think that's what you want to look for. And you also want to look for what helps best. So try different brands. See what helps your kid. I don't think there's one answer for all that. Deborah, Bartonella causes OCD? Any infection can cause OCD if it triggers an autoimmune reaction. Period. Bartonella. viruses, strep bacteria, parasites, you name it. Yesenia, any Epstein-Barr recommendations? By the way, the tan looks great. Thank you, Yesenia. I appreciate that. As a 50-year-old, any compliments are appreciated. Yes, I've been doing a lot of yard work and spending a lot of time outside with my daughter, who's 11, and we have a lot of fun. So, and my ancestry is Southern Polish, and you know, we get darker skin. Anyway, Epstein-Barr. Yes, it's a virus. Kill it. How you say? Try this, Viragone. Okay. We also have another supplement, ViraClear. Do I have that one here? No, it's in my kitchen. Try ViraClear and Viragone. Those are great natural supplements for viruses. Guadalupe, are you currently taking new patients? Yes, I am. Definitely. Go to our website, spectrumawakening.com, click appointments, and sign up for one. Deborah says, MCAS and OCD? Yes. Mast cell activation syndrome. We didn't really get into this, and I'm glad you brought it up, Deb. There's another chemical in the brain called histamine. Wait a minute, histamine, that's the stuff with allergies, isn't it? Yeah, it is. But histamine is a massive brain stimulant. So if you find your child gets OCD or behaviors during stereotypical allergy season, spring or fall, try different supplements that help manage histamine, like our Allergon supplement, or there's others on the market. Vitamin C is a great one as well. But definitely, because histamine is a stimulant. Deb says, Polish here, wish I got the 10. Yeah, the northern Polish, you know, you're more blonde, and the southern Polish, you know, there's a split there. I'm not sure where the split is. My family's from Krakow. But, yeah, dzień dobry. Dzień dobry. All right, everybody. That's all the live questions for today. So, OCD, hey, people have it. Our kids have it. Kids on the spectrum, not on the spectrum. Just understand these obsessions and these compulsions are to make us feel happier, because we don't, okay? And I want you to look at your kids where, boy, yeah, they stress us out, sure do, but, you know, come at them with some empathy and understand they're not happy. And if they're not happy, why? Are they in pain? Or is their brain on fire? And what can we do? We can change brain chemistry easy. I can give you more serotonin. I can lower your adrenaline level in a hot second. That's easily done with natural supplements, because that stuff is made from the foods we eat, period. Okay? You don't need pharmaceuticals to do that. So, and pharmaceuticals have too many side effects. I mean, why would we give antidepressants that have side effects of suicidal ideation and give it to a kid who can't speak and can't share that they're feeling sad? All right? Let's use something natural with less side effects, people. Lost my train of thought when I get angry. So you can do that. It's not gonna hit the core of it if it's autoimmune and it's inflammation. You've got to use anti-inflammatories. You've got to use antimicrobials. Boost up that vitamin D and change that cortisol level. Your child's going to feel better. All right. Try this stuff. It works fast. You should see changes within 3 weeks when you do these things, okay? And this, I know this because this is what I do in my practice for 20 years. I see the changes fast. If you don't see changes in 3 weeks, it's not the right treatment, okay? Again, Spectrum Awakening, 30-day return policy, send it back to try something else, but keep at it, all right? Esha, what's your review about ketoprofen? We're using it for eczema. It's helped the itching, but not resolving the root cause. He has strep, OCD. You got to do gut work. You got to do gut work for eczema. Period. Make sure you've tested your food and environmental allergies. Carla, thank you for this information. It was very informative. You're welcome, Carla. That's why we do these podcasts recorded on Facebook live every Thursday. We've been doing them for over 5 years. We put them up on Podcast World, YouTube. We're putting them up on Rumble. But again, you know, I'm here to help you help your child with autism, whether that's telemedicine appointments, whether that's lab testing. You can get lab tests through me through an appointment. You can get lab testing on our website. You want an oat, you want a stool, you want genetics, you want food testing. Go to our website. We've got them there, okay? We've got the supplements that I've created for my patients based on scientific research and 20 years of clinical experience. All right. We want the stuff to work. If you guys are outside of the U.S., yes, we do ship international, but it's expensive. Try our European distributor, Mandymart. Okay, he's got a place in the UK and the place in the EU after Brexit. And we do have a guy in South Africa. I think his name is Zenergy, but just Google South Africa and Spectrum Awakening. All right. Thank you guys for tuning in. And make sure, I want you guys to go to our Instagram page and follow us. We're putting a lot more stuff up there, and spread the word. I love helping you guys, but I need you to tell other families that there's hope for your child. Hope everybody has a great week. I'll see you next time.